Sinusitis is an inflammation of the sinuses, which are air-filled spaces around our nose and eyes. We will talk about how to identify and the top 5 treatments for sinusitis. Normally, we have 4 pairs of sinuses. From the forehead, behind the cheeks, between the eyes, and behind the nose, deeper in the skull. Normally, these sinuses produce mucus, humidify, and filter the air we breathe. They protect the head during trauma, act as shock absorbers, and lighten the skull. When the sinus lining tissues are infected and inflamed, the sinus becomes blocked and filled with fluid, causing symptoms.
The most common sign of sinusitis is facial pain or pressure. This is an almost universal symptom of sinusitis. Pain is usually in the forehead, cheeks, or around the eyes. Pain worsens when a person bends forward. The second sign is nasal congestion and blockage. The person feels a sense of fullness or difficulty breathing through the nose. This congestion prevents normal mucus drainage. The third sign is thick nasal discharge, which is also very common, seen in almost 80% of sinusitis cases. Yellow or green mucus drains from the nose or down the throat. This mucus can be thick and cause a sore throat or coughing. The fourth common sign is headache. People describe it as pressure in the sinuses that leads to a frontal headache. A headache may worsen in the morning due to mucus buildup overnight.
Fever is the 5th most common sign. It is not very common but possible, especially in acute bacterial sinusitis. In viral cases, fever is possible but rare. Other signs are possible but less common, such as fatigue, general tiredness, and loss of smell. In most cases, sinusitis, almost 90%, is caused by a viral infection. Viral sinusitis is associated with the common cold and respiratory infections, usually resolving within 10 days. Bacterial sinusitis is rare but more serious. It commonly follows a viral infection that doesn't resolve. This is why antibiotics are required if symptoms persist for more than 10 days or worsen after initial improvement. In rare cases, fungal infections can also cause sinusitis. This happens in people with weakened immune systems, diabetes, or those on immunosuppressive therapy. If sinusitis lasts more than 12 weeks, it is considered chronic sinusitis. In chronic cases, bacterial infection is the primary cause in almost 70% of cases. Fungal infection occurs in 5% of cases, and viral infection is also rare. The remaining portion is due to allergic rhinitis, asthma, and nasal polyps.
Now let's talk about treatment. When sinusitis is not chronic and occurs acutely, the goal is to relieve symptoms and promote mucus drainage from the sinus cavities. Intranasal decongestants like oxymetazoline 2 sprays per nostril twice a day, but for no more than 5 days, are commonly used. Sign: oral decongestants like pseudoephedrine. Analgesics like ibuprofen or acetaminophen are recommended. Intranasal corticosteroids like fluticasone and mometasone are especially effective if the person has allergic rhinitis. Antibiotics are used only in bacterial infections. If symptoms last more than 10 days without improvement, a bacterial infection is more likely, especially if fever is present, purulent discharge, and facial pain last for more than 4 consecutive days.
Worsening symptoms after initial improvement are called double worsening. In this case, first-line treatment is amoxicillin clavulanate, 875 milligrams twice a day for 5 to 7 days. Amoxicillin alone can be used in milder cases. In severe cases, higher doses of amoxicillin clavulanate are prescribed for 7 days. Doxycycline is used for patients with penicillin allergy. Levofloxacin is considered for patients with severe symptoms, although fluoroquinolones carry risks of tendon rupture and neuropathy. For chronic sinusitis, the first-line treatment is intranasal corticosteroids as the main treatment. Fluticasone, mometasone, or budesonide nasal sprays are used daily for long-term management. Nasal saline irrigation is also considered an important treatment, such as high-volume rinses. The saline solution is made by mixing 1 teaspoon of non-iodized salt and half a teaspoon of baking soda with 1 liter of sterile or boiled water. Or you can buy saline.
Is a neti pot, squeeze bottle or bulb syringe. The saline should be lukewarm, not hot or cold. Stand over a sink, tilt your head slightly to one side and irrigate one nostril. Insert the tip of the neti pot or squeeze bottle into the upper nostril. The solution flows through your nose and comes out of the lower nostril. Breathe through your mouth during the process. Repeat on the other side. Gently blow your nose to remove remaining liquid and mucus. Do this 1 to 2 times per day for 1 to 2 weeks until symptoms improve. It can also be done longer as part of long-term management. For antibiotics, azithromycin 500 milligrams once weekly for 3 months is used, or clarithromycin. This endoscopic surgical intervention is needed when a person has nasal polyps or structural abnormalities, or when medical treatment is not effective. Surgery can remove polyps, widen sinus openings, and improve drainage. Sinusitis generally affects almost 15% of the population annually. Chronic sinusitis affects around 12 to 15% of the population. Viral sinusitis resolves within 2 weeks in 98% of cases. Recurrence is not uncommon. In cases of chronic sinusitis, around 60% of patients will experience improvement. Surgery is highly effective in most cases.